Okay, yes, let's
Okay.
do
All right,
it.
please continue.
We'll record it, so we'll
We're talking, we're going to do our formal introduction. I'm Erin Trent Johnson, and I'm here with Dr. A, Antonio Aragona, Doctor of Ayurvedic Medicine. I call him Dr. A. He is my doctor of Ayurvedic medicine as well. And I am a transformational leadership coach. And we are talking today about diagnosis. But I think we both know that we're talking about what's at the root cause or the root of our experience, and what are the limitations or the ways in which Ayurveda sees diagnosis and the ways in which Western medicine sees diagnosis. In that, though, we're having this conversation about shlokas and what the Western mind can handle. Is that what we're talking about?
yeah, I think this is gonna be like a, a pretty
Yeah, we're just talking.
relaxed podcast on Ayurveda and Western medicine as a whole. And not to exclude the other systems of medicine, like
Hmm.
Chinese medicine, naturopathy, homeopathy, indigenous medicine. Like, if anything, Ayurveda will be in support of, this concept of like holistic, which are like the other systems, and then allopathy, which isn't as holistic yet, and they're aspiring, which is fine. So
Hmm.
instead of making this a Eastern versus Western or holistic versus allopathy, it's this and that, because from the Ayurvedic perspective, um, it should be all included. We're not about divisiveness.
That's right.
And
That's right.
so, and we were talking about the shlokas, and so understanding, like, I can share this as we were talking about this before in the sidelines.
Hmm.
I was recently speaking to a colleague who, we were sharing notes about when we do podcasts and things like that. And I say, typically when I do podcasts, um, I introduce a shloka, which is like uh, you know, a line from one of the traditional Ayurvedic medical texts, and it starts the tone, it sets the stage for like the unfolding of the discussion. And from his perspective, he leaves all that out because he says, at least as far as his audience is concerned, they're not interested, they're not capable, they just can't, and they don't want to. And so, just to clarify, even just starting with Ayurveda and shlokas and things like that, it's about the delivery of how important certain things are. And it's how you bring it together versus introducing some foreign concept that no one knows from the West. Because, yeah, Eastern medicine in general, Chinese medicine was very foreign up until like the late 80s, So
Hmm.
before then, it was like straggling throughout the US since the 1800s, if not more than that, because people from China were coming to the US for a while. It's understanding and like context, background, tradition, purpose. And if we think about it from the simple logical perspective, Chinese medicine and Ayurvedic medicine and these other indigenous medicines, even Native American, like these have been around for thousands of years.
Hmm.
And they were taking care of people long before allopathy came in to be like, here's the perfect model. And so something must have been working because people were not usually dying typically.
Hmm.
Were there traditions that had like advanced techniques of like extreme bloodletting or something like that? Of course. But as with every system, as you're trying to figure out a scientific understanding to and foundation to some of these things, there's trial and error. That's why we have trials in Western medicine. Unfortunately, there's a greater casualty in Western medicine with trials and using animals. Like Chinese medicine and Ayurvedic medicine never used trials on animals ever. We already understood animals to know like how things would work appropriately, and even use the animals as medicine. And we didn't use people directly as experiments to determine like, does this work? Through proper analysis, through proper um uh critiquing, through proper judgment, through logic, things were deduced and inferred, and came from this deeply rooted place where you studied extensively, you meditated extensively to really open up to consciousness, to be clear, so you can see things more clearly. So the Ayurvedic perspective, since that's what I'm focusing on, will encompass the other holistic models, and Western medicine is slowly coming to like a general understanding of that there's maybe more than just the mechanics of things. And
Hmm.
so with the shlokas, it seems like it could be like arbitrary or mystical or any of these things. But if you don't really know, then you won't have the deep respect for these kind of things that imbibe that kind of energy of like, what is the purpose of this line coming from this text and how does it relate? And so you know, it's like if that person doesn't know, then it's up to you. It's up to me as the clinician or practitioner of Ayurveda to get you in the know. That's why you're coming to
That's right.
this.
That's right. I want to just pause you for a second because I think, when we start, we are starting our whenever we start the podcast, when we start recording, we've usually had a conversation in advance about what we want to talk
Mhm,
about. Usually it's either inspired by a theme that we're working with, the season. It could be inspired by what I'm dealing with in my body and what we're talking about that emerges, the wisdom that emerges. And it is critical to me that we start with the shloka because there's always what usually happens is we're talking, and we identify a point of wisdom that comes from a shloka. This is um, uh, absolutely why I come to you. I go to my allopathic doctor, my Western medical doctor, and I have 15 minutes. And if they can't find what I'm talking about on a quick search, a quick Google search,
mhm,
right? Or even if not even that, right? If it's not in the immediate reach that is coming from what data they have available, right? What data they have from journals and from trials, then
mhm,
that it doesn't exist or we don't have time. And so my health and healing needs to be guided by a deeper wisdom. I don't need to start something, or I want to start always with some kind of ritual that says what we're doing is sacred.
mhm.
Now, yes, some people want to just consume. They want to consume information. I have podcasts where I listen to it. I'm like, I just want to hear what blood work you did so that I can
Mhm,
go talk to my doctor. I don't care a lot of this other stuff you're talking about. That's not what we're doing. Right. And so I think if we were talking about what lives at the surface
mhm,
around our health or dis-ease and
mhm.
imbalance, um, then yeah, that we would be doing a totally different podcast. We would be also um, we would be doing a totally different kind of medicine.
Yeah,
So yeah, I don't desire to start anything without uh, the sacred
that's
text that guides us.
yeah.
That sounds like a crime against wisdom to me.
No, and it's true because it's like, I've been hungry for Ayurveda since the first day that even the word was introduced to me. And, I do have this affinity already for Eastern medicine because even before studying Ayurveda, when I was studying Chinese medicine, it was like an internal inclination towards like, there's something more than allopathy. Because when I was
Right.
going more in a Western direction and I was going to become, I was planning to become a clinical psychologist. I was already I finished my bachelor's in psych and then I took a break so I can like absorb and make money and have my own apartment for the first time because I was like,
Mhm.
I can go back to school, but I want that was a goal, and then I can go back to school and then go for my PhD in clinical psych and do clinical practice and all those things. And life just redirected me to this level of, experience. And but I knew there was like a bridge that I was crossing because I was like, even in clinical psych studies, I was like, I- I'm not convinced there's something more that I need. And
Mhm.
so that inner knowing, I follow that. And that was my compass. And that's what's taken me to this point. And so Ayurveda has been the thing that came on the horizon because once Chinese medicine was coming in, I was like, this is great. Ayurveda came in and just blew it away. And I have a respect for
Mm.
all of it. That's why I have, this capacity to know a lot of the different systems because I've studied a lot of the different systems. And, Ayurveda really does take it to the heart of the matter. And so,
That's right.
the shlokas, are just the written versions in these texts from these masters of Ayurveda, these master physicians of Ayurveda, these master scientists, these master spiritualists that had it all together wrapped up on under one great, package that, when you're connecting to the original material, it's like knowing that this energy, this wisdom, this science has been around for almost 10,000 years.
Mhm.
It's not just like words on paper. It's like it's the respect of knowing something that's endured the test of time, you know. Ayurveda has it all figured out. It does know it all.
Mhm.
And then it's a matter of like extrapolating from the content and applying it to each person, which is why Western golden standard scientific models will not work because you can't treat everyone like one size fits all. It cannot be done. Ayurveda is like we group things according to like certain physiological processes, which we know as doshas, and subcategories of dhatus, which are tissues, and shodasis, which are channels, and agni, which are states of digestion. Like there's a lot of things. And so the simplicity of it is like the shlokas bring you to the heart of the matter, and you can reread any one of these lines, and each time something else is going to ring. And it's like, this makes sense, and then it all connects. And even talking about the heart of matter, we had this podcast, I think, in February talking about the heart of
Yes, we
matter,
did.
right?
Hmm.
So a cool thing that I remember learning in my clinical training was, early on, actually, I took a pulse class in Albuquerque with a well-known Ayurvedic physician, and he said, and I'm going to make this sort of like parallel understanding. Western medicine, they go to read your pulse for like, you know, your heart rate, basically.
Hmm. Hmm.
And so putting your fingers on the radial pulse, because the pulse comes from the pulsation of the heart as it's moving the blood through the channel, through the vein, and the artery. And it's like from the Western perspective, like, okay, I'm just learning this as a tool. That's a physiological thing to understand, like what's the heart rate. From the Ayurvedic clinical perspective, and he said this, and that's always rung true. As soon as you put your fingers on a pulse, you're not just palpating that experience of what the heart's doing. You're actually going into the heart of the patient.
Hmm.
And he emphasizes it in training, which it's great. He's like, from a clear state of clarity of mind, you drop into this deeper state, and you can get into the heart of the person and what's the matter
Hmm.
and what's there. So it's like you're unlocking a lot of sub qualities from just touching the pulse. So it's not just an anatomic, like, I just want to see your heart rate. One, we do
Hmm.
3 fingers versus 2 because this is representing the doshas. Um, and 2, it's like we're following this adventure of the heart as it's pulsating through the artery, through the veins, you know, um, this sort of like it's like a subtle soliloquy because
Mm.
you're just kind of following the person's story from their
Hmm.
heartbeat, because that's the essence. Once the heartbeat stops,
Hmm.
done. You're done. When you can tap into the person's heart, you get to start to know them more. It becomes more of an intimate process.
Yes.
And from the tantric perspective, when you're aligned with a person's breathing, aligned with a person's heart rate, you're in their field. You're part of them. This is the
Hmm.
intimate intertwining that's happening. So you're merging with the consciousness. And if you're keeping yourself clear, you get more clarity on like what the person's about, what they're coming in with, what their backstory is, things like that. That would fall into the Western category of there's no evidence to indicate that, and there's no proof that you're connecting to their psyche, their spirit, their all these things, because but that's not the holistic way.
And I think, to your point, there's no proof. The I think one of the things that makes me feel sick, right? Like when I go to the doctor, um, when I go to, the allopathic doctor, which is in like a very sterile medical building, and I am sitting at the table, or whether I'm on the table or in the chair far away, and there's a person looking at their computer. You use your computer when we talk as well, but there's a difference where their whole focus is on what is available here that I can use to prove what she's saying is real. And I think that my body just is very much aware. Not I think, I know
Mm,
that I'm receiving those signals and I'm defensive. I think a lot of times I think I come into the doctor's office already guarded. So there's a sympathetic activation, I'm certain, that you know, is there.
hmm
And I feel the need to prove or to seek validation that what I'm experiencing is real.
hmm
And I think that there's that the limitations that exist in that model. And again, I know we work with the all of it, right? I'm working with allopathic doctors. I'm working
hmm
with Ayurvedic medicine. I'm working with various holistic practices to create the care that I need. And um, it's exhausting going to the allopathic doctor. I'm like, I'm having trouble with my memory right now and my energy, and I am more depleted when I leave the doctor.
Yeah, it can seem that way. I mean, and Western doctors especially are exhausted because patients are increasing in numbers over
Mm-hmm.
time,
Mm-hmm.
and there aren't enough doctors still, as many doctors as there are to like address every single patient all the time. I
Yes,
mean, how many places get backlogged from the inundation of how many people are coming in with so many things. So, I mean, it's like, what is the doctor doing to take care of him or herself as well to
that's
maintain their
right.
own integrity, health? And, a system that you see a patient every 5 minutes is not sustainable,
That's right.
right? So even for the doctor, and we have to think about this too. When I was in pre-med, some of my classmates were talking and they already knew I had an Ayurvedic perspective and I was just coming to become a DO so that I can do more Ayurveda that way. But although colleagues were like, we're just going for surgery and cardiology and all these things, and that's what they wanted to specialize in med school. And I was like, great. And I could tell from the colleagues, um, you know, the ones that really had heart, that were driven by
Mm-hmm.
heart to do the work.
Mm-hmm.
Um, because once you enter the doors of med school, especially, it's like you're beaten a lot,
Yeah,
so it's a grueling process. And so how many of these physicians that graduate from these medical programs are still coming out with the energy, enthusiasm, passion, and integrity that they went into it with the purpose of helping,
that's right.
right? And um, you know, so they were coming from the heart from that place, and so if you're still aligned with that, like one of my favorite iconic models of Western medicine and having heart and joy is, Dr. Patch Adams. Uh,
Yes,
And, you know, like he was in his 40s and he went back to med school because at somebody had some breakthrough when he was having a psychiatric breakdown that he wanted to help people. And that's what he did. And he created the Gesundheit Institute in, I think, it's either Western Virginia or Virginia. And he still practices to this day. Like, how amazing. And he brings joy and he dresses up as a clown and he has like this passion, this zeal, it's like, he went through and he was much later than these like modern Western doctors that are in their 20s, right?
mm-hmm.
This guy is now in like what, probably 70s, and he's an enthusiastic physician inspiring people around the world with bringing joy and happiness as part of the medicine. Like that's he it's a prerequisite for him.
Yes,
And but Western doctors today are inundated. There's more diseases developing today because of the times that we live in, and this is only going to continue. So an Ayurvedic perspective has its own ups and downs because it's gone through its own grueling process over the millennia where English invaded and did this, and Muslim invaded and did that, and all the neighboring regions affected Ayurveda. But, so it's not uncommon today that, from a family in Ayurveda in India, you're like fifth generation Vaidya physician, then you're following your path, your dharma, because you're born into it and you don't doubt your purpose and you have heart in it. And then there are other ones that are like, well, I couldn't become an MD in India, so I became a BAMS, which is similar to MD, just Ayurvedic. And um, you're just doing it because, well, by default, I couldn't do this, so I'm doing this instead. We kind of do that
mm-hmm.
in the West. I don't know if it's still 100% the way it was like 10, 15 years ago. Couldn't make the MD board, so I took the DO boards instead. And
Hmm.
MDs, I think,
Hmm.
work more hand in hand with DOs because DOs worked pretty hard to establish itself. Um, and it is, it's still like the MD would like poo-poo,
Yes.
and it's like, how about we just work together instead of work against each other and try to shoot each other in the foot and shoot each other down, that's the bigger scope of this. And with Ayurveda, it's like Western, Ayurveda, of course we have tests. We didn't have like fancy MRIs and CAT scans and X-ray machines and things like that. And um, but we have, and they're still used today, especially within traditional Ayurveda, like, oh, there's a great movie that came out like in 2000 called The Art of Being. And it's
Hmm.
one of the, I think, the first Ayurveda documentaries that I watched back in the day. I watched it in 2003, 2004. And and it gives you like understanding like there's a scene where an Ayurvedic physician had read the scrolls, original scrolls of the Vedic, the Ayurvedic texts, and they're like, oh, to determine if this person has this condition, you dig a hole in the ground, you put this particular thing on them, and then if this particular spot shows up on their skin, it indicates that they have this, and this. We've had tests. We have tests. There are things that
Hmm.
we do testing. And then an alignment with understanding that everything can be medicinal because there's a shloka in Ayurveda. I'd have to think about where it is to recite it, but it's like, you know, everything can be, I think it's from Ashtanga Hridayam. Everything is medicinal. And equally, if misused, could be a poison. Doesn't matter what it is.
Yes.
And conversely, every poison that's considered a poison can be used as a medicine if used with proper logic and knowing like why this is going to work, because we work from a different standpoint of qualities and physiological functions, energetic functions, electromagnetic function. Like we calculate all this, and if we're going to pick that medicine, it's not by accident.
Hmm.
And it's like, yeah, like you can use gasoline as a medicine to apply for certain skin diseases if you really need to. And it was done. Like one of my mentors and one of my professors told me a story about being in India, and it was a patient that had something happen, and they used gasoline because they understood the qualities of gasoline, and the person's condition reversed pretty quickly, like topically applying it.
Right.
And so it's like, Chinese medicine and Eastern medicine uses venom of snakes and scorpions, and like, so it's like knowing, and Western medicine kind of does it too, right? It's trying to learn from, like, where do you think they get
That's
these
what
ideas
chemotherapy
from?
is. Yes. Well, that, yes.
And then they just try to like myopically fit it into a certain spot. And they use leech treatments, but leech treatments have been around for like 10,000 years. Bloodletting has been around from a lot of traditions, from the Iraqi tradition to the Muslim tradition. Like, so bloodletting is not, they were using it in the Aztecs,
Right.
like,
I think it's called apheresis now, though.
yeah,
If you
yeah,
go,
yeah.
right, it's uh, a
Mm.
plasma separation, or is that different? Where you're
No,
separating the
apheresis
plasma.
is a different process because they're trying to like dissect and understand certain qualities of the blood and whatever they're targeting through the apheresis. Um,
Okay.
Simple bloodletting is like going for blood work,
Yes.
right?
Okay. Yes.
And or in surgery, like there are certain conditions where sometimes you have to do a slice with the scalpel
Right.
to release the blood from the local area that might be infected.
Hmm.
So this is not uncommon, but it's been practiced for thousands of years. And so there's a lot of things, that Western medicine has adapted from the Eastern perspective and then tries to take credit for it, of course, but
Yes.
that's fine, not fine. And, so these diagnostic tools that are evolving today with all these great million-dollar machineries, Ayurveda says, and sometimes, especially if you're working within the context of the Western model and on the land, we can say you need to get certain images. Let's get
Hmm.
that information. Like we know what the imaging is going to do to the
That's
body
right.
anyway. So you might get a picture of something you need, and I read we can rectify it with certain herbal protocols, cleansing protocols like panchakarma or
Hmm.
something. So we can always undo a lot of things just from these simple things. If someone needs chemo, yeah, chemo is a poison in Ayurveda, but it also
Hmm.
does do its job because, like gasoline, it does destroy things. It does
Hmm.
destroys the bad things and the good things.
That's right.
So it's knowing from the Ayurvedic perspective how it can all work and how it Ayurveda knows how it all works.
How it all works. I mean, I think this is also why when we talk about diagnosis, one of the things that really sits with me is um, how we cut ourselves up or cut ourselves off in and create these fragmented um either or kind of binary ways of thinking. And so the idea that it must be this and it can't be anything else, or
Mhm.
something is a poison, and when it's used, right, that it automatically does damage, that there's no other way to to view it, to understand the medicine or how it's working. And I think this really, speaks to it, the rigidity, right, um, that I think a lot of folks are held in or held within when trying to seek care, right? I want to say for me, I know that I've had a lot of anxiety around figuring out what's at the root cause. Like, what is going on with all these symptoms? Like, this is not a cold. This is this is all right. I
Mhm.
have all of these disparate symptoms. What is it? I think that they'll say on my sheet, non-specific.
Mhm.
Um, but we cannot locate where all of this stuff is coming from. So we need to pick one and focus on that, which would make sense to me. But also, I think the anxiety comes from um, feeling like there must be one way. And I think that that is where we feel stuck in trying to
Mhm.
get our care. Like, I know we've talked about this. Um, I'm like, I just need a diagnosis. I just need a diagnosis. Like, and my hands are like this. Like,
Yeah.
I need relief. I need to improve my quality of life. And that kind of angst, right, doesn't allow for there to be more room to say, okay, well, maybe I need treatment, and
Mhm.
maybe the diagnosis um, might not really be what I'm looking for or what I
Mhm.
need, because it's cutting me up into little pieces and not seeing the whole of me.
Yeah, so even saying like the word, diagnosis, like so there's a lot of different angles. Like, because Eastern medicine, Ayurvedic medicine, we do diagnoses, right? We have different system of compartmentalization, labeling per the doshas and which one's involved and all of these things. And so every system that's that level of science will have a diagnostic capacity. And so Western medicine's not excluded. And because getting a diagnosis helps to give anchorage to what's happening to a list of you know characteristics, traits, symptoms, right?
Mhm.
And so it gives some sort of clarity. um I think Western medicine has taken it to a whole other level where it does diagnoses for a lot of things, and a lot of the bling words are like IBS,
Mhm.
cancer, these kind of things, depression, anxiety, you know, and it's now being run away with.
Yes.
And, you know, so for the purpose of getting diagnostics and a diagnosis, it can give clarity, which gives peace, like, I know there's something happening. Now I know what that thing is. And now I know that there's a treatment protocol that can address this thing.
Right.
And because I read it, we have a lot of diagnosis for a lot of different conditions. And but even in the context of Ayurveda, even Charaka says, and sometimes even with that disease that doesn't have a name can still be addressed and treated, you know.
Mhm.
And it's like a reverse engineering, because it's like as long as you can understand, doshas, dhatus, which are the tissues, shrodasis, which are the channels, agni, which are the different states of digestion and its functioning, all these things. And you can have clarity of knowing you're still working within the doshas, because as a physiological material, the doshas are physiological. Dhatus are physiological. Shrodasis are physiological. We know how to look for them. We know how to find them. They're not just made up concepts. Um, it's not a placebo effect. people haven't been treated for 10,000 years or 8,000 years under the context of placebo, because
Hmm.
that's enough experimentation to indicate, power of suggestion. Yes, positive suggestion is always going to be positive. Negative suggestion, not so much, right? But knowing that um, sometimes there's going to be, I don't know what this is called, but we can still work with it. And that's the key. It can still be worked with because now
Right.
we're knowing, you know, because putting a label under the microscope gives you a thing to see and categorizes it. And it's like, but you take the microscope down a little further, or you increase the magnitude of its ability to see, and you get more microscopic, and you're like, well, whatever it's called, doesn't matter. I can see this stuff happening here, and this is
Yes.
what can be addressed. And it's not uncommon for an Ayurvedic doctor to get um, cases from Western medicine. They're like, I don't know, they reach their maximum capacity, and so go here instead. And
That's what they said to me. But I want to say though that they can say that to you, and nobody's health insurance is going to cover what
yes,
you need, right? If I don't
yeah,
have that the code,
yeah,
right? 003.1.
yeah, yeah,
If I don't have that code, there's no resources for that. There's no, and it's not even resources. There's no copay for that. There's no.
yeah, yeah. I mean,
So I'm just speaking to like both the psychological, experiential limitations of what happens when you're so desperately seeking diagnosis.
yeah,
And then there's the material, financial,
yeah,
real world. How am I going to pay for this care, right? When I no longer, when I think the exact words were, it seems as though you've reached the limits of traditional medicine.
yeah,
And thank you for not uh telling me to try all of these different medicines, um
mm,
right,
yeah.
and but also now what.
Yeah, no, and that's the part that's tricky. And the other point to mention with the diagnosis is that for some people it gives clarity. For other people, it creates a conviction to use that as their primary identity,
Yes.
which becomes a point of asphyxiation.
Hmm.
Um, because, for simple purposes, when a potential patient contacts me, they're like, oh, do you treat cancer? Do you treat ulcerative colitis? Do you treat osteoporosis? Do you treat And, going back to the original words of my first mentor of Ayurveda, who has passed, you know, he would say, I'm not treating the disease, I'm treating the person that got the disease.
Hmm.
And, because then it's a matter of understanding the person as a whole and like, how did you get to this point of osteoporosis, ulcerative colitis? Because each person is going to have a slightly different, trajectory, like how they manifested their present symptomatology. And
Hmm.
in Ayurveda, this is why we spend like an hour and a half, 2 hours just even at the consult to like let me get a bigger picture of like where all these things came from and get to the root as close to that as possible, to see how did we end up here. Because in Ayurveda, this is I think the point where I can bring a shloka
Yes.
in. Let's see, where did it go? As I'm looking for it. Um, Now it escaped me. It's kind of funny. Well, I'm going to look for it as I'm talking to you. But,
Okay.
so the point is, knowing like the person as a whole, getting to
Hmm.
the heart of the matter, really seeing the person for where they're at and what they're coming in with,
Hmm.
um, this is the shloka. It's in Charaka, of course. Prayojanam cha asya swastasya swasta raktarshanam maturasya vikara prashamanam cha. And so basically, and this is a simple shloka, the purpose of this science is to preserve the health of the healthy and cure the disease of the unhealthy. Or it's another way, it's like to maintain health of the healthy and yeah, reverse sickness. And cure is the buzzword, and no science can really claim cure.
That's right.
It's definitely illegal for any non-medical doctor to claim cure, say cure, imply cure, all these things. So we would just say like resolution. And so in Chataka's shloka about maintaining the health of the healthy and preventing the sick of the sick, um, it's really understanding what is it really saying. It's like it's that simple. It's like Ayurveda brings it to where like, well, if you don't really have many conditions, we can watch the momentum and how it's developing and forecast like this could head there because we know cause and effect. We talked about this in another podcast, Karana Karya.
Mhm.
It's like, yeah, you have these little percolations for now, but if these percolations continue, it goes from this drop of water dripping into a bucket to this overflow of a bucket that's manifesting and spreading everywhere and destroying the whole basement because that little tiny leak that you ignored, that pipe will burst unless you
Mhm.
address it. Similarly in Ayurveda, it's like that occasional. I took Tums when I was in my 20s because I had some heartburn once in a while and 30s and 40s. Time is part of the medicine. Time is also part of the disease process. We talked about
Yes.
parinam as one of the third
Mhm.
causes of disease. And it's like, yeah, that spigot that you ignore that you're taking occasional Tums for, you're already in stage one of like where stage six is. Because in Ayurveda with diagnosis, we have a whole thing. It's like there's so many like angles and like diagnostics in Ayurveda. And it's very fascinating to think about like how Ayurveda really sees it from a lot of different perspective. We have six stages of disease called samprapti. And it's like when you finally get, so the six stages, I'll go through them quickly, is, Sanchaya, Prakopa, Prasara, Sthana, Samshraya, Vyakta, and Beta. And so it's like beta is like when you get the actual diagnosis, right?
Mhm.
Um, Usually in Western medicine, when things start to show up in the labs, you're already at stage three in Ayurveda
Yes.
with diagnosis, you know. Um, You're not picking up stage one or two yet. Ayurveda wants to go back to like, what was stage one of this process? Because we know sequentially it follows this logic of like, nothing comes out of nothing. Something must be there, and if something is there, where did it start from? We can always find where it starts from. Even and Western medicine doesn't include this because there's no scientific evidence to indicate that there's a past life karma, anything. Ayurveda already knows there is, and that's fine.
Mhm.
We have differences. So it could be karmic that influence the physiological body that you're manifested into in this lifetime. That's part of the story unfolding. Like, why do children have, when children are born with conditions? Yes, the conditions were parents' conditions. What were
Mhm.
they inheriting at that point of like the ovum and the sperm joining? That consciousness was already coming together. But you go far further back and you're like, because Ayurveda has a whole chapter or two or 30 on like how do you develop a proper pregnancy? It's like,
Mhm.
and we cultivate both parents to a certain consciousness, health, mind, body, and spirit, to optimize that fruit that's going to come out from that soil of the seeds planted. So if you're like, well, here's a bed, it's kind of raggedy, it kind of has some weeds, but we're just going to throw some seeds and hope that tomatoes will grow. The tomatoes will grow, but they might be a little pinchy. They might have a little bit of like contaminant from the soil because eating, like, of course, what is the consciousness in the moment? But then in Ayurveda, we understand because a lot of this is about consciousness that, we'll just say there's this energy souls that are just hanging around, waiting for the right entrance in. So the consciousness that the both parents bring in together will draw in, let's call it through samanya, which is like this sort of like law of attraction, like a
Mhm.
like quality. So whatever the consciousness is at that moment of conception is going to draw in the like quality of that energy of what we're coming into as the gate. All right, so with Ayurvedic diagnosis, yes, there's a six-step process of disease formation, but this is also determined by like factors of environment, factors of hereditary, factors of like soul contracts and karmic consciousness, like all of it, we factor all this in, and
Mhm.
then we bring that into like the application to each person today. Like, what are they coming in with? So if I have, 2-year-old that comes in and has jaundice. Yeah, where did this come from? Did it come from this life in this body through mom and dad, bad diet, bad lifestyle, all these things, poor season, like whatever? or did it come before that? Like these are the things that we look at in understanding, and Western medicine is missing that. But Western medicine is also doing the best that it can as a newer system of medicine that's
That's right.
evolving. So it's not the fault that it's like the child that's trying to be in grad school,
Yes.
and Ayurveda is like past grad school. Because the thing is, like, as long as you don't get the whole person, you won't get the whole picture, and you won't get the whole story how to like address the person. And
That's right.
similarly, you know, in Ayurveda, you're in a physical body, so you have to take care of it. So what are you doing with diet and lifestyle? These are the basics, and Ayurveda has extensive literature, extensive chapters on like delineating what are the practices that are needed to cultivate proper health. The
Hmm.
basics. Go to sleep, like we talked about, like in the past, like go to sleep at a certain time, wake up at a certain time, eat at certain times, and you're on the clock. Yes, you're on the 24-hour cycle clock. And it's by far more complex and complicated, and also not, to the circadian rhythm.
Hmm.
Right?
That's
Ayurveda
right.
knows there's a circadian rhythm, but we don't talk about it. Like we know it makes sense, but we're also a little bit more elaborate in like there is a cycle. You're following the season of the day, the season of the month, season of the time of year, season of the year. What year is it? And what year is it in life? So it's, you know, so we factor in all these pieces, and there's a lot of things simultaneously happening all the time. And so it's not Eastern versus Western. It can be Eastern and Western working together. And Eastern has a better understanding of how Western works. Western doesn't have a good of an idea as how Eastern works.
Yes. I'm finding that, post COVID, um, at least in my, hyper focused research around the cluster of symptoms that could be called long COVID, could be called MECFS or chronic fatigue syndrome, could be called mast cell activation or MCAS, could be called, right? Like could be called dysautonomia, could be called POTS. In my like desperate searches for the diagnosis, um, I find that there are more and more doctors who are honest, or at least Western medicine doctors, allopathic doctors, who are seeing an increase in these unexplained multisystemic diseases, disorders, autoimmune responses. And they are acknowledging, oh, we have an influx, right, of patients who have essentially created a new syndrome. We wouldn't even
Mhm.
have the label, of long COVID, because you really don't have a diagnosis of long COVID. You have an elimination of a whole bunch of other diagnoses. And then they say, well, then this must be long COVID, which it could have been called rheumatoid arthritis. It could have been called, right? Like it could be called a lot of things. And I find that I'm hearing more doctors, more allopathic doctors say, there's so much we don't know,
Mhm.
right? There's a humility, and I am aware that it's 2025. I have been experiencing some of these symptoms since 2022. I've had uh two COVID infections, one in 22, one in 23. You got me through both of them, and I know that when certain aspects of my lifestyle, right, stress, like intense stress, um, and pregnancy loss. When there are intense stressors, physiological, psychological stresses to my whole being, that it has disrupted digestion, disrupted um, uh, my nervous system regulation. And
Mhm.
so I'm aware of this, and I'm finding that um, there are now maybe more doctors that are saying, you know what, there's so much we don't know. And without the absolutism, without the attachment to absolutism. Um, and I'm finding that there's some wisdom in that, in the
Yeah.
I don't know.
No, and that's important because to make like you know and you don't know doesn't suggest humility, right? Or humbleness, because we don't know it all. So even in Ayurveda, it's like, I don't know, but let me kind of sit with it. Let me reflect with some colleagues. Let me speak to my mentor, that might know and
Hmm.
create more of a knowing to the unknowing. But it's okay to be like, I don't know, versus like, I think I know, and you shoot from that angle, but then you misfire, and then you create a problem.
But I feel like there's an invitation for me as a patient when I hear the curiosity and the I don't know. Let me find, like, you will go to a textbook in front of me. You will say, I'm going to talk to my mentor. And I feel a partnership. I feel excited. I want to learn what you learned. I want to, right? And yes, when I'm in deep pain, I just want a pill. Um,
Hmm.
right? And at the same time, I want to learn too. I think that that creates more capacity in my nervous system. It creates more ease, right? That I'm able to be with what is
Hmm.
without a defended attachment. There's an invitation into a partnership of
Hmm.
not knowing. And I'm actually okay with that. Like, let's
Yeah.
figure it out together. Like, I'm
Yeah.
okay with that.
Yeah, and then it's also a matter of time, and time is part of the medicine because we sometimes need time for the medicine. We need time to
Yes.
figure it out. We need time for it to resolve, or we need time for it to reveal itself so we can get more clear on some things. Like there's a lot of levels and angles and these kind of things. And
Yes.
what's the cost? What's the immediacy? The immediacy is contingent upon like how severe is the present moment of pain. Do some people have a lower pain threshold than others, and it's this like amplification, like, oh my God, and that's where like you have to like bring it to more homeostasis and bring it down where it's not, a little cut isn't like you're dying, right?
Hmm.
And because some people are dying and they treat it like it's a little cut, like it's a mental state, which is great. And what's the cost as far as financial? Like Western medicine will cost you a lot more if you don't have insurance and good insurance, and Ayurveda will cost you. Like I'm definitely within the school of Ayurveda where like there should be, adequate financial resources to support the journey. If you have more chronic condition, you're gonna have a longer journey. You're gonna have to sustain,
Hmm.
by paying. I know there are some schools of thought in Ayurveda like, oh, it should be less or free or what are these things, and each person has to explore that. I mean, in this Ayurveda documentary in 2000, The Art of Being, there's a Vaidya that's been like part of the forest tradition of Ayurveda, which is great. And he basically like harvests certain herbs from the forest for the medicine for the day of the people lining up for the day, and he charges nothing. He just
Mm.
reads their pulse within 15 minutes. He says, take this, and this, and they go, and he does it for free. And this is good. This is his karma, this is dharma, but it's not any
Mhm.
different from any one of us that has to live in the world in a different way, and that's a prerequisite. It's a spectrum. Some Ayurvedic physicians will go to astronomical costs that are almost like Western medicine, and some will be like right in a happy spot, which I think I'm in a happy spot as much as possible, applicable to cost of living and USA and all of these things, and everything is going up. And so there's a balance. Western medicine, of course. One Ayurveda, you get one medication for a month, it's never going to cost you $3,000.
That,
One medication, you know,
that's right.
let alone the
That's it.
testing that goes to $40,000 just for
Hmm.
like a simple like series of X-rays or CAT scan. Like, these are all the things that we think about. And so within the context of Ayurveda and Western medicine, it's finding the right doctor that comes from the place of the heart that really wants to still help in spite of their overwhelm, you know.
That's right.
And it's like Western medicine's definitely gonna be more overwhelmed. If you're in private practice, it's a little bit easier, I think, if you're in Western medicine, but also depends on what's your rotation. 15 minutes per patient, 5 minutes per patient, half hour per patient, 45 minutes, you get determine the time. And in Ayurveda, it's like sometimes you need less time with an Ayurvedic trained physician that's been doing it for a very long time at that magnitude of mastery that within 15 minutes they can do a lot too. But
Hmm.
you see that proof in the pudding from the diagnosis that they come to the recommendations that are helping, and you're like, you don't doubt if you're paying $300 for 15 minutes seeing an Ayurvedic physician at
Hmm.
that level because they're at that place,
Yes.
and so it's all cause and effect and correlating to like the person and what they're putting out there. and each person you have to
Yes.
resonate with the doctor. It's like some doctors you might like and some doctors you don't like, and that's across the board, you know. And it's like, and sometimes medicine is bitter, and you don't, and you want to hear the sweetness,
Hey,
which is important, but sometimes some people have different approaches, and personally, some patients think I'm the sweetest, most kindest patient, compassionate, friendly, loving, and other patients I'm a little bit more like crack the whip, and they don't like it, and I'm
oh,
gonna.
I've been in trouble.
I've been in trouble. There are moments that like I might be a little like intense that day, as I'm also human, and if a
But I
patient,
also appreciate it.
yeah, and then
You're
some
also
patients
a
might be like,
human, and we cannot
I've had patients
dehumanize.
say like, if you had a little bit more sugar in your talk and like I need this right now, then I drop down. I'm like, I hear you. All right, got it. Let's redo this again.
Ah,
You know, if there's one, it's funny because in Ayurvedic medicine we have a thing where like you don't really treat a patient that thinks they're the doctor.
yes, that's right.
I'm a little tricky because when I go see doctors, they know I'm a doctor. I'm like, well, let's have a conversation here. I don't agree. So doctors do make the worst patients.
Yes,
But pseudo
I,
doctors also make the worst patients. Pseudo doctors are the people that are like, well, Google and Chat GPT told me this. No, shut that down.
yes. What about YouTube? No, I'm just kidding.
Yeah, exactly. So, all this to say, like, it's not Eastern versus Western. It's not allopathy versus Ayurveda. It's
It's not
Ayurveda
patient
and
versus doctor.
or doctor versus doctor. Because if if a Western doctor sends patients to an Ayurvedic doctor because they're in that category, like we don't know what else to do, you've maxed out this, that, and the other thing, and then the Ayurvedic doctor figures it out,
Mm-hmm.
then there's one of two Western doctors that will react one of two ways. They'll be like, "This is great, this is amazing. I'll send more patients to this guy,"
Mm-hmm.
or I'm annoyed that he or she figured it out and create this negative energy. And I've
Mm-hmm.
seen and heard stories like that where like
Ooh.
it's like I had a colleague that had, his patient was struggling with cancer and couldn't afford to keep doing all the chemo and treatments. And she was like, I don't want to do this anymore. I'd rather die. And so my, uh, colleague was like, let's do this for a couple months. And the cancer completely went into remission, completely gone. And the oncologist was sending angry calls to my colleague, like, what did you do? Why did you like how? Rather than like, it's amazing. I'm so
Yes.
happy you helped this patient to live and I
Yes.
couldn't do it. They got offended that their expertise was challenged.
Mm,
And there's no room for ego
that's
because
right.
at the end of the day, everyone wants, I'm sure, it's like everyone wants to feel good. So try just keep that in mind. Like you want to be treated, you want to be treated like a person as much as
That's right.
possible.
That's right.
And you want to
Mm.
feel better. That's the point at all costs. So
Well, this has been a great talk for this episode. I'm super excited. I have to go see an allopathic doctor, and I'm going to be walking in with an open mindset and leave my research in my purse.
yeah.
um, but I want to thank you, Dr. A. And I would love for people to know where they can find you for in person here in Philly or for telehealth wherever you are.
Yeah, still point Ayurveda. And yes, I'm always open to new patients. I'm always open to adventures with each patient. So come on in virtually or physically.
Yes. And I want to put that out there into the world that there's an invitation to a heart-centered care that um, really is unparalleled. So thank you so much. And we will see you next month.
See you next month.